I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakanna. I'm one of the co-founders. And like I said, the whole month of June, we're dedicating to the men that we love, the men in our lives. Tonight, I'm going to talk about prostate cancer. We're going to talk about cannabis and CBD and how we can really assist those that we love that are dealing with a prostate issue. So I am an obstetrician gynecologist. I'm a still practicing OB-GYN. In fact, I'm on call, every Wednesday I'm on call here at the hospital. Tonight we have two ladies in labor. One is 8 centimeters, the other one is 3 centimeters. So if you've had a baby, you may know what that means. So one is close to having a baby and one is kind of far away from having a baby. But I'm still a practicing physician doing C-sections, hysterectomies, liposuctions. But what I want to tell you is that I come from a family of entrepreneurs. And I also come from a family of men that passed away from prostate cancer. In fact, this is my grandfather, Richard Carr McGuire. He owned one of the largest grocery stores on the west side of Chicago. In fact, the grocery store was located where the University of Illinois ENT clinics are now being held. So if you ever go into the University of Illinois, you're getting your eyes checked or your nose checked, you're seeing an ENT doctor, you will see this picture in the lobby on the wall. And then next to him is my dad, Richard Rudolph McGuire. And both my father and my grandfather unfortunately passed away from prostate cancer. In fact, there's my father there with Martin Luther King Jr. In fact, if they both were living today, I'm sure both of them will be peacefully protesting. But my father was a chemical engineer, and back in the 50s, he couldn't find a job because he was an African-American man, and so he ended up working for Fuller Products and working as a chemist. And then he was inspired by Mr. Fuller, S.B. Fuller, to go into business for himself. So my dad owned one of the largest African-American furniture companies in Chicago, right here on the South Side. So with him was my brother Richard Rudolph McGuire Jr. He passed away from a very rare cancer of the gallbladder. But just know that we're dedicating this month to the men that we love and really helping and assisting them if they have prostate cancer or prostate issues, how CBD can assist them. So let's look at the prostate gland, because many of you may not know where it's located, and it's located right below the bladder. That's why when men have issues with their prostate, be it inflammation or infection, or maybe it's benign hypertrophy, it's not a cancer, but it's enlarged, or maybe if it's a cancer prostate gland, it causes a lot of urinary symptoms. Why? Because the bladder has this tube called the urethra that helps men urinate. And when it enlarges, it causes either retention, so the urine can't get out. It causes a lot of pain because there's backup of urine in the bladder. And it also causes a lot of sexual dysfunction because you see the seminal vesicles, you see the testicles, all of the sexual organs are involved in an enlarged prostate gland. So that's just a little anatomy for you. So what is the function of the gland? Well, it is the male's reproductive organ, and its main function is really to secrete fluid. This fluid is called seminal fluid, and that's the fluid that nourishes and transports sperm. So it's really important in fertility. It's really important in reproduction. The muscles that are surrounding the prostate gland also help not only to propel the seminal fluid into the urethra, that tube, during ejaculation, but also helps a man's libido. So this prostate gland is a really, really important gland that we want to help men to protect this gland. We want this gland to be healthy and not to be harmed. So some of the ways to reduce your risk of prostate cancer, and I'm all about prevention. I'm that doctor that understands that we need to prevent things before they become a problem. And we all know that the diet is the most important thing that you can do right now in this webinar to protect your prostate. A healthy diet, a diet that is plant-based, a diet that is free from processed foods and fried foods, a diet that is full of fruits and vegetables, healthy lean protein like chicken and turkey and fish, and then maintaining a healthy weight, because you'll see that every single chronic condition, when we go from diabetes, hypertension, heart disease, arthritis, it's the inflammation of the fat cells that causes a lot of issues in chronic conditions. So maintaining a healthy weight, how do you do that? Well, choosing a healthy diet and exercising, making sure that you're becoming active at least 4 to 5 days a week, at least 30 minutes or more. And then men, we know you men don't like going to the doctor, right? Making sure that you're getting yearly prostate exams and getting early detections with something called a PSA, which is a blood test. So those are the fundamental things that we can do right now for the men in our lives. The men that we love is really making sure that they're eating healthy, they're maintaining a healthy weight, they're exercising, they're getting frequent exams, and they're getting screening for early detection. I want to tell you a little story. My dad was relatively healthy. He was not overweight. He played tennis 3 to 4 times a day, or 3 to 4 times a week. He pretty much had a healthy, active lifestyle. But what increased his risk was the fact that he had someone in his family, a genetic predisposition for prostate cancer. So you have to understand that knowing your family history is really important. Finding out if there's anyone else in your family that has had a history of prostate cancer, and there is some link to even those who may be in your family who are females that have breast cancer. So prostate cancer is when you have tumors that are involving the glands of the prostate. The most common prostate cancer is something called adenocarcinoma, and it develops within the gland of that prostate. Risk factors you should know about. As you age, that increases your risk of prostate cancer. Being Black increases the risk of prostate cancer. Why? Well, many Black men have less access to health care. Sometimes the social economic predisposition of our men, not having insurance, not being able to get tested, and just the stigma, the stigma of what we'll talk about soon, the exam of having the prostate tested. Family history, again, know your family history. Find out if there's anyone else in your family that has prostate cancer, even those in your family that may have breast cancer, so that BRCA1 gene or BRCA2 gene puts you at risk, and obesity. Obesity men are diagnosed with prostate cancer and have more chance of having an advanced prostate cancer when it is diagnosed. So this is what men dread. It's just like us women when we dread that cervical screening test, which is called a pap smear. Men, you have to go through something called a rectal exam, where your urologist or maybe your primary care physician has to put a finger in the rectum and palpate or feel your prostate gland. Your prostate gland, again, it lies right underneath the bladder, and you can feel it when you go through the rectum. If it feels irregular, if it feels enlarged, if it feels lumpy, that is a sign that you could possibly have an issue with your prostate. One of the next things your physician will do is draw your blood. It's called a PSA. It's called a prostate-specific antigen test. Now, this test can be kind of confusing. Why? Because the prostate gland produces PSA normal. So it's normal to find some levels of PSA in your blood. But when it's high, that brings on a high suspicion that it could be prostate cancer. It can also be some other things that are going on with you. You could have a urinary tract infection that can cause an elevated PSA. Your prostate could have been stimulated by having anal sex, or maybe you just had a recent ejaculation that can cause an elevated PSA. Vigorous exercise can cause an elevation of PSA, and certain medications. And guess which medications can cause your PSA to be elevated? You probably guessed it already. Non-steroidal anti-inflammatory drugs like Motrin, like Aleve, like ibuprofen. Many men take those medications for pain. Another medication that can increase your PSA, statins. Those are medications to lower your cholesterol. And then diuretics, water pills. You may be placed on a water pill that you're using for high blood pressure. All of those medications can falsely elevate your PSA as well. So the screening for prostate cancer is controversial. The American Association of Urologists, they feel that all men should be screened for prostate cancer. If you're a Black man, or if you are a man that has a family history, typically you will be screened in your 40s. If you have no family history, you're not African American, most screening with the PSA starts at 50, as well as, remember, you've got to get that rectal exam. Now, as you get older, if you've never been screened, that is not recommended, but it is to the discretion of your physician if you're over 70, if they would screen you at that point. So you've gotten the rectal exam, your doctor feels your prostate is enlarged, you get a PSA blood test, your PSA is elevated. The other tools that we use to diagnose prostate cancer is either an ultrasound, or we'll do a biopsy. So the biopsy, again, is a needle, very thin needle, that is taking a small sample of the prostate tissue, and we test it for cancer. MRIs are also used as well. Now, some of the symptoms that those who have prostate cancer have are typically pain, and the pain could be really subtle. You know, it could be stiffness in the lower back. You may think that, you know, maybe I worked out too hard, or maybe it's a little arthritis in my hips or my pelvic area, or even upper thighs. A man may start to notice painful ejaculations, and absolutely, as the prostate enlarges, it will start to affect the urinary tract, the bladder, difficulty in urinating, maybe dribbling of urine, maybe excessive urination at night. You're up all night going to the bathroom. That's one of the number one symptoms that men will have that will bring them to the physician. Or maybe it's just a weak urinary stream. So because the prostate is located right under that bladder, it will cause a lot of symptoms as it relates to urination. Now, some of the treatment modalities, obviously, if it is an aggressive cancer that is diagnosed and it's not a surgical candidate anymore because it's metastasized, palliative care, hospice care is what they will offer you. You know, unfortunately, when my dad was diagnosed, it was past the seminal vesicle. And what was really crazy about my dad's condition was that he was tested every single year. Every year he got a digital exam. They didn't have PSAs Back then, it wasn't really big, but he was not a surgical candidate. So my dad underwent radiation. Brachytherapy or full body or pelvic radiation is what was offered to him. If you are a surgical candidate, they'll go in and remove the prostate through a laparoscope or a larger incision. And then there's medications. Medications like hormone assisted therapy, which puts men in menopause, is an awful drug. My dad was on that as well. Chemotherapy, he did receive chemotherapy once his cancer became aggressive, and other urinary retention medications. So those are the traditional treatment that men will undergo. But the side effects are awful. Side effects include pain. Side effects include long-term urinary incontinence, where a man cannot hold his urine. He may have to wear a diaper. He may have to have an indwelling Foley catheter in his penis. He may have long-term erectile dysfunction. It really, really does cause and affect their overall sexual libido, bowel problems, and temporary fatigue and loss of energy. So these are the side effects that we're going to address, that our products can help in those who have even undergone treatment. So testosterone is that hormone that is lost once a man has his prostate gland removed. His libido just goes down to the basement. So we want to help these men with their testosterone effects and their erectile dysfunction. Those are one of the biggest problems that those who have prostate cancer and large prostate deal with. Some of the other causes of erectile dysfunction you see here, but one thing that we want to address are the psychological issues. You know, when a man has erectile dysfunction, it causes a lot of stress and anxiety, a lot of depression. So we're going to talk about how CBD will address those psychological conditions that those who have erectile dysfunction. And we want to really help men spice up their love life. We know that the prostate gland is the male reproductive gland. When it is removed, they have issues with libido, erectile dysfunction, stress, depression. And so some of the holistic approaches, hitting the gym, you know, having a balanced diet, reducing stress levels, and taking CBD. So we're going to talk about our product line here at Wakanna. I'm actually, again, the pillar of health. So if you joined late, I'm the Chief Medical Officer for Wakanna. I'm Dr. Rita McGuire, and we're going to talk about a lot of our products specifically for those men who have prostate cancer, who have gone through therapy of prostate cancer, or may have benign prostate hypertrophy or enlargement of their prostate. Now, a little bit about our company. Well, you know what? We're more than a company. We're a movement. And I say we're a movement because our whole vision is to really help end the stigma that's caused communities around the world to suffer and lose out on the health and wealth benefits of the cannabis plant. We know that when we say the word cannabis, people who have that negative stigma that surrounds the plant thinks we're talking about getting high. But you're going to learn tonight that we're going to talk about the part of the plant that gives us the health benefit without the high. And then our mission. Our mission is that we are the catalyst to stir a movement that inspires people to confidently move into the legal space as entrepreneurs, as formulators, as investors, really evoking the courage and strength of people to take back their health, wealth, legacy, and freedom. And we want our men to take back their health as it relates to holistic, organic, natural way of addressing their health. I want you to meet the co-founders of Wakanna, our CEO, Melissa Boston. She's the visionary behind Wakanna. She brings over 29 years of direct sales experience, as well as over 15 years in corporate America. In fact, she fired her boss at the age of 32 and a half years old. She is a social media strategist. She has built businesses in over 40 countries. She's trained over 50,000 distributors. She's truly our visionary behind Wakanna. And then our president, Dr. Patricia Van Pelt, is a state senator right here in Illinois. She's serving her third term. She's an entrepreneur. She is a businesswoman and an evangelist. And then Phyllis Nash, our fabulous Phyllis Nash, is Senior VP of Sales. She brings over 30 years of business experience, not only in the liquor industry, but as well as real estate. And then myself, Dr. Rita McGuire, I'm the Chief Medical Officer, bring to you over 30 years in healthcare as an obstetrician gynecologist. And we are so excited to have launched this company a year ago, April 20th of 2019. So let's talk about cannabis. Now, this slide is the most important slide tonight. This slide explains the different species of the cannabis plant. So the cannabis plant has over 100 plus compounds, what we call as cannabinoids. The most common two are THC, or delta-9 tetrahydrocannabinol. That is the compound that gives you the high, that gives you the paranoia, that gives you the euphoria. And then there's CBD. I had never heard of CBD 3 years ago, but CBD, or cannabidiol, is the non-psychoactive part of the plant. It's a part of the plant that gives you the health benefits without the high. We're going to talk about how CBD helps men who have prostate cancer or who have prostate hypertrophy or enlarged prostate. Now, the cannabis plant has two species. One's a marijuana species. That's the species that gets you high. It has a high level of THC and very low levels of CBD. We're not talking about marijuana tonight. What we are talking about tonight is the hemp species. That's a part of the cannabis plant that has trace amounts of THC. In fact, it has 0.3% or less by definition, and it has high levels of CBD. So it gives you the health without the high. So CBD stands for cannabidiol. I've been using CBD in my practice for the last 3 years. It has no mind-altering effects. That means you cannot get high on any of our products. Zero, none, no high, no euphoria, no paranoia, none of that, just the health benefits. So when we look at CBD, it has a long list of medicinal properties, a long list. The other cannabinoids, yes, they have medicinal properties, but it's CBD that helps to relieve pain, that helps to relieve anxiety, that reduces inflammation, that actually helps relieve psychosis. It stimulates the appetite. It reduces nausea, real important in those men who may be undergoing chemotherapy or even radiation. It reduces seizures, convulsions. It prevents the nervous system degeneration, meaning that it's very important in those who have had strokes or seizures or Parkinson's or any neurodegenerative disorder. It suppresses muscle spasms. It manages blood sugar. It treats psoriasis, eczema, acne. It inhibits cancer cell growth. It inhibits cancer cell growth. There's over 20,000 peer-reviewed articles that line out how CBD also inhibits cancer cell growth. It inhibits the metastasis of cancer. It reduces the risk of arterial blockage. It increases bone growth, and it kills or slows bacterial growth. So these are some of the many medicinal benefits that CBD has. So you may be asking now, how does it do all of those things? And there's science, there's real science behind how CBD works. And the science is through the endocannabinoid system. This system is deemed one of the most vital regulatory systems within the human body. It's made up of a group of receptors. These receptors are found throughout the entire body, in the brain, in the central nervous system, in the immune system, in the periphery, in the testicles, in the bladder, in the seminal vesicles. in the male reproductive organs, in the female reproductive organs, in the bones, in the lymph, in the bone marrow, in the tongue, in the kidney, the liver, the stomach. In every single organ and gland, these receptors are looking for cannabis. It's looking for CBD to put the body back in balance. So as you can see, not only are there CB1 and CB2 receptors, but there's all these other receptors that are found throughout the human body to put the body back in balance when it's out of balance. Specifically, in the prostate gland, the endocannabinoid system is very, very important. There's a study that was done in 2011. It was published in Nature Review in the urology journal. If there are any healthcare professions on the webinar, you can look this study up, and how the CB1 receptors within the prostate gland, the endocannabinoid system is looking for CBD to help decrease the inflammation, to help inhibit cancer cell growth, and to inhibit metastasis. There's also another study. This study shows how there are receptors in the bladder. So when those receptors are fed in the bladder, those CB1 and CB2 receptors in the bladder, it helps to decrease incontinence in men. It helps to decrease the symptom of the overreactive bladder in men. So there's real science, guys, in how CBD works. There's also science in how CBD helps men with erectile dysfunction. How does it do that? Well, CBD is a vasorelaxant. It helps to relax blood vessels. It helps to promote blood flow in the penis. Better blood flow can help relieve erectile dysfunction. That can promote an erection and lower lasting sex. Real science, guys, about how CBD works. We also know that CBD can improve your sex life and your libido by reducing stress and anxiety. Massaging CBD oil on the male genital glands. All of these things, eating edibles before having sex. So we're going to talk specifically about our products and how to use them, because the science is there. There's science about how CBD affects depression and anxiety. Well, those receptors called dopamine and serotonin in those who are depressed, those who are very anxious. They're depressed and anxious because maybe they've just been diagnosed with prostate cancer, or maybe their anxiety and depression is at an all-time high because now they're going through chemotherapy or radiation. CBD comes in and helps to release higher levels of dopamine, higher levels of serotonin, which in turn improves mood, and it reduces depression, reduces anxiety, and also improves appetite and improves their sleep. So CBD has so many side benefits for those who are undergoing not only treatment for prostate cancer, and maybe those who have already had treatment, or those who are dealing with sexual dysfunction because of treatment, or those who just need a product to help to assist to prevent that from occurring, prostate cancer. So our product line is very professionally labeled and packaged. It's very safe and effective. Our products are all organic. They're double certified. They're third-party validated. We have a power line on the left that contains the legal limit of THC. It's what we call our broad spectrum product with 0.3% or less of THC, CBD, and all the other cannabinoids, as well as our pure products. Our pure products are on the right side. Those are broad spectrum products. They're great for those who have random drug screens at their job and don't want to fail that urine drug screen. The pure products on the right are products for your male. So our products are products you can trust. Not all CBD products are made equally. And we know that, right? You can find CBD products at gas stations and smoke shops and in places that we know that that product is not tested. We provide some of the most rich medicinal hemp that's fully compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, and our products are Farm Bill compliant, meaning that the Farm Bill, which was passed in 2018, specifically states that any CBD that is cultivated, grown, or sold in the US has to come from the hemp species and has to contain less than 0.3% or less of THC. We're also very transparent and committed to quality and high standards at Wakanna. We offer certificates of analysis on every single product here at Wakanna. The certificate of analysis allows you to see the potency of the product. It allows you to see all of the cannabinoids, the milligrams that are within the bottle. Very, very critical in this market to have certificates of analysis. How do you take CBD tincture oils? Very easily. You place it underneath the tongue. It's best to hold the oil for 60 seconds before you swallow so that the CBD is absorbed in the bloodstream. It's important to also know that the FDA does not approve of any of these statements. So if you are pregnant, nursing, well, you wouldn't be if you're a man, but if you're on any medication, if you're under a doctor's care, please consult with your physician before taking any nutraceutical products. So our first product that I want to recommend for men who are dealing with prostate issues, are dealing with side effects to the treatments of prostate cancer, are dealing with anxiety, depression, or pain due to prostate cancer is our Hempranium 500 milligrams. Now, this is a proprietary formulation, meaning that this is very unique to Wakanna. This is a CBD product that is enhanced with a proprietary formulation of black seed, turmeric, peppermint, and we use MCT and hemp seed oil as our carrier oil. This is very unique to the marketplace. No other CBD products have a proprietary formula as we do because we understand that black seed and turmeric and even peppermint actually enhance the anti-inflammatory properties as well as the antioxidative properties of CBD and actually help to reduce inflammation in the body. We know that black seed also helps to rebuild the beta cells of the pancreas. Many men who have prostate cancer have comorbidities, either with diabetes, obesity, or hypertension. The recommended dosing on this product is 3 drops twice a day. Starting low and starting slow is really important. When you start a CBD product, more is not better. So 3 drops twice a day will give you about a 12 milligram daily dose of CBD. So that's a great, great starting dose initially. After 4 or 5 days, you may need to increase that to 8 drops twice a day. The maximum dose is 15 drops a day. The next product I recommend for those men is a topical liquid relief. It's Dr. Rita's Rub. We understand that pain is one of the other symptoms that men who have prostate cancer will have, especially if it starts to metastasize to the bone. Pain is a big issue. This is a topical product that's 200 milligrams of CBD. It's a great, great product because it has a proprietary formulation. Again, we've taken it to the next level. We've enhanced the CBD oil with 19 to 20 organic USDA certified essential oils that address inflammation. This product is amazing, not only because it addresses pain and inflammation and swelling, but because you also only need a little bit. Remember, the #1 medication over the counter that most men take for pain is what? Ibuprofen, Motrin, and Aleve. That was one of the medications that can falsely increase a PSA. So we want to get our men off of those over-the-counter medications. Long-term use also causes kidney failure. We want to use a topical CBD product instead. Our Diamond Life pre-roll. This is a CBD joint or CBD cigarette. But remember, none of our products get you high. This is a great product for men because one of the other risk factors for prostate cancer is heavy smoking. So if you're dealing with a man that's a smoker, dealing with some prostate issues, this not only will help him get off of cigarettes because CBD blocks the reward centers, it blocks the cravings of nicotine, and it also helps to reduce the withdrawal symptoms that those who are coming off of nicotine. But more importantly, this product acts quickly in the bloodstream. So it's going to, within 1 to 5 minutes, reduce anxiety or depression. It's going to help to reduce pain and inflammation. It's going to help to calm a man's nerves. It's going to help, again, those receptors in the bladder to help them sleep at night so they're not up all night urinating. That's our Diamond Life pre-roll, 100 milligrams of CBD. We don't want you to smoke the entire pre-roll in one sitting. No one needs that much CBD in one sitting. 1 to 3 pulls, maybe 3 times a day is all you need. Now, our CBD sexual enhancement lube, this is a lube that you're going to want to use, and you're going to want to rub it on the testicles, the scrotum, and the penis, right? This is going to enhance the sensitivity. It's going to enhance the sensation. It's also going to help the wife or the girlfriend to have lubrication. So this is absolutely a product that's needed in a man that's going through prostate cancer treatment, prostate hypertrophy. It's going to enhance the sensation during intercourse. It's also water-based, so it's compatible with condoms as well. So you're going to want to use this to really rub all over a man's sexual organs. And then the Power Mango Body Cream is a great body cream for men who may have skin irritation due to radiation. Radiation can cause a lot of skin dryness. It can cause a lot of skin irritation and inflammation. So you're going to want to use that Power Mango Body Cream, 500 milligrams, of CBD to address, again, those skin manifestations that occur after radiation therapy, or just for men to have more moisture in their skin. Now, our gummies are something that you're going to want to use every single night. You're going to want to use a gummy before intercourse. It's going to help reduce anxiety. It's going to help reduce depression. And when it's time to go to sleep, it's going to help you sleep. Each gummy is 25 milligrams of CBD. This particular gummy is a full spectrum gummy. It contains less than 0.3% of THC. So again, if you have random drug screens, you want to take our pure gummy. But this is absolutely a must in men who are dealing with erectile dysfunction, men who are dealing with libido issues, men who are dealing with inflammation and pain, and men who have insomnia and are dealing with prostate conditions. Our gummies, Power Gummies, come in a 20-count bottle, and they also come in a 4-count package. They are a great taste, and they absolutely are something for our men. Our broad spectrum gummies. Now, this is a gummy for those men who have random drug screens. Again, you're going to want to use a gummy every night for sleep. You're going to use it before intercourse to boost that libido, to help bring down anxiety and stress. Men have stress and anxiety when they're trying to perform. So we need our men to take these gummies every night. This particular gummy is 40 milligrams of CBD in each gummy. It has less than 0.0% of THC. It comes in a 16-pack count as well as a 4-pack count. Again, for sleep, sex, and inflammation. And then for those men who may have lost hair due to chemotherapy or any of the other hormonal treatments that men get when they have prostate cancer. It's our hemp-powered hair. Yes, this is a product that can be used both in men and women. This is a product that can be used internally. So you're going to take it as a tincture. You're going to put 6 drops under the tongue 3 times a day, or you can use it topically right on your scalp, right in the area that's caused thinning in the hair. You're going to use 6 drops twice a day. So I love this product because men use it. In fact, we have a man, Minister Mooney, who's one of my business partners, who uses it on his beard. So any area where radiation may have taken your hair out, yes, if you still have a follicle in that area, you can use this product to restore that hair. So we talked about Father's Day. This is the time that you can bless a man in your life that is dealing with prostate cancer, benign prostate hypertrophy, enlargement of the prostate, or any other condition that you know that your man is dealing with, and any man that you love. It can be an uncle, a grandfather, a nephew, a cousin, a son. Our Father's Day special comes with that CBD liquid relief that we talked about that you can use for pain and inflammation. It also includes the Hempranium 500 tincture that you're going to use twice a day. It comes with the Power gummies. It comes with the broad spectrum gummies in a 4-pack, the Power gummies in the 20-pack. It also comes with a pre-roll, and it comes with a Father's Day card. Now this is $119.95. It's going to be available until June 30th. You're saving 40% on retail value of $198. You're going to want to include that CBD sexual lube. You're going to want to include that lotion, because those 2 items don't come in this Father's Day pack, but you absolutely want to bless those men that you love that suffer from prostate cancer, suffer from a prostate condition, that suffer from any other male. Last week we talked about male menopause, andropause, that suffer from low testosterone, that suffer from low libido, that suffer from erectile dysfunction. We want to help our men, each and every man in our life, with our Father's Day package. So we also know that CBD is magical, but we've got to help it to be even more magical, if that's a word. And we want to help our men with a healthy lifestyle, a healthy, active lifestyle. I can't stress enough, we've got to help our men eat healthy, a plant-based diet. So tonight, like I offered, we want to encourage them to be strong like this guy here, right? To work out. But I offered last week, and I'm offering it every week to men only. Any man that's on this webinar that wants to lose weight, wants help with exercise, wants help to improve the quality of their life, I will coach them for free in our weight loss management Facebook page. I'm only accepting serious men, because I'm serious about healthy, active lifestyle. So if there is a business partner on the webinar, you have to be referred by one of my business partners to be a part of our weight loss management program. I will coach you for free. So at this time, I'm going to take questions. I want to remind you that every Tuesday we have a full presentation. If you are interested more about our other products and our business opportunity, I do a Tuesday 8 p.m. webinar as well. We want you to join that if you're available. So right now I'm going to stop sharing my screen, and I'm going to take questions. And it looks like we have a lot of questions. Thank you, Dr. Rita. Great presentation. Thank you, Karen. When does the weight loss program start? It's already started. We started back in February, but I'm only taking serious men to be a part of the program, and they need to be on our CBD products to be a part of the program as well. Questions. Let's see. Has the Father's Day special package been extended past June 2nd? Yes, it's been extended to June 30th. Hemp-powered hair really works. Yes, it does. Thank you for that testimony. Wonderful presentation. Awesome. Great job. Thank you. Outstanding presentation as usual. Tied all the products together. Absolutely. Can all of these products be used together, or is it best to pick or choose? No. We want you to use, Fred, all of these products together. Now let me explain why we want you to use the products all together. The reason being is because the onset of action, Fred, and the duration is different on every product. For example, the tinctures, that's the oil you place underneath your tongue. The tincture takes about 15 to 20 minutes to get into your bloodstream, right? And it will last in your bloodstream for about 6 hours. The pre-roll, it can get into the bloodstream within 1 to 5 minutes, but it only lasts an hour. So as you take your pull on the pre-roll, in an hour, the effects are going to be gone. So that's why you want that tincture, right, in your bloodstream, because that tincture is going to be working for the next 6 hours. You're going to want to repeat that tincture twice a day. You also have a topical product. The topical pain relief is going to work between 5 and 10 minutes. It's going to last topically for local relief for about 2, maybe 3 hours. So you always have a product that's going to kick in, and when the other one stops working, is out of your system, then the next one's going to kick in into the bloodstream. So that's why you want to take a gummy at night. In fact, I have a lot of my patients that will take a gummy at night, and they'll use the pain topical rub, and they'll rub it in areas at night that they have pain. So while they're sleeping, they've got the gummy working all night to decrease inflammation, pain, and help them sleep. And they've got a local relief product to give them local relief so they can sleep throughout the entire night. The CBD taken at night, that's your second dose, is going to work on those receptors in the bladder so you're not up all night urinating. So that's why it's best to use a combination of all the products, the different methods of ingestion, so that the CBD is in the bloodstream for the full 24 hours. So great question. Let's see. What if your prostate has been removed? If your prostate has been removed, you absolutely probably need all of the products. Why? Because when it's removed, your testosterone level goes down. It's almost like when I do a hysterectomy on a woman and I remove her ovaries with her uterus, her estrogen level goes down. So a woman needs help with her libido, right? Like a man will need help with his libido because his prostate has been removed. That testosterone levels are low. So yes, you still need the products if your prostate has been removed. Yes, there will be a recording. Great explanation of prostate cancer causes and symptoms. Most of my prostates are extremely scared to be involved with CBD. They said their job do not recommend it. Okay, great question. Conrad, if you can find out from a lot of your prospects exactly what testing they're doing at their job, because a lot of employers are scaring folks about taking CBD, but I personally, as a physician, I've never seen a urine drug screen test for CBD, a urine drug screen test for THC. So ask the prospect to go to HR and ask their HR department specifically, what are you testing in my urine? And if it's THC, which it typically is, you will offer your prospects our broad spectrum products. The topical products do not pass the blood-brain barrier. So you can use the topical pain relief product in any area that's causing pain and pass a urine drug screen. You can use our empowered hair in your scalp. It doesn't pass the blood-brain barrier and still pass your drug screen. So find out from HR exactly what they're testing for. Awesome. Congrats to Ray Foreman, who's joining the weight loss program. Well, congratulations, Ray. You will be ready to go. For a person that takes tests, what products would they use? Teresa, I'm assuming that you're asking a urine drug screen. They will use the pure products. Those are the products that are in the white labels, our broad spectrum product. Thank you, Charlotte. Wonderful information. Thank you. Thank you. So we are now at 8:51. Whoever invited you on this line really, really loves you. Really, really loves you. We want you to contact that person so that you can get your products. You can get your products ordered. You can order the package. You can order products a la carte. Makes more sense to order the package. It's a 40% discount, 40% savings that you're having with that Father's Day package. How do we sign up for the program? Which program? Are you talking about the weight loss program? If you're trying to sign up for the weight loss program, you can only be recommended by one of my business partners to get in the weight loss program. You have to be serious. So whoever invited you to this webinar, you want to talk to them about recommending you to the weight loss program. You need to be on our CBD products to be in the weight loss program. And we want you to contact the person who invited you on this webinar so that you can get your products ordered. And we have one last question. Is the Power Liquid Relief good to use for migraine headaches? Absolutely, yes. You can take that Dr. Rita's rub and you can rub it on your temples. You can rub it on the back of your neck if you have occipital migraine headaches. Oh my goodness, works amazing. Pop a gummy in, take 1 or 2 pulls on that CBD joint, and you will find amazing relief. The weight loss program is not open for women at this point for the month of June. It is for men only, and those men have to be referred by one of our business partners, and the men have to be on our CBD products. So thank you again. Have an amazing night. Contact the person who invited you on this webinar. Look out for the recording. Oh, I also want to invite each and every one of you to join our Facebook page, Wakanna for Life. Ask to join our Facebook page. You'll get more updates, more recordings, great information, empowering you to get past the negative stigma about this plant. Good night. We'll see you tomorrow on our Thursday business overview. Again, you can get that link from the person who invited you on the call. Have a great evening. I'm going to go deliver these babies, and we'll see you soon.